Ever wondered what your golden years will look like? Will they be filled with toil and stress, or choices and meaning? If you're aiming for the latter, here's what MoneyOwl can do for you. We'll help you make wise financial decisions to reach your retirement aspirations. Our financial advisors are fully salaried and don't earn product commissions, which means you'll only be recommended affordable and fit-for-purpose solutions. As Singapore's first bionic financial advisor, you'll get the best mix of technological and human capabilities to give you the financial help you need. To us, being wise about money is about having a sensible and balanced outlook on life. In other words, life decisions before financial decisions. That's why we take a holistic approach to your financial planning so you can retire well. We can help you check your financial health, protect your income from life risks through insurance, grow your wealth through investment, and get that passive income you've always wanted. Optimize your CPF and project your retirement income from it. And write your will to ensure your loved ones are taken care of. You can either do a comprehensive plan with us covering all these aspects, or access one of these services directly. It's never too late to begin your journey towards a fulfilling retirement. Head over to moneyowl.com.sg or call us to get started on your retirement goals today.
Hi, good evening, everybody. Can everybody hear me? Yeah, hi. Hello, everybody. Welcome for joining us this evening. I'm Daphne from MoneyOwl, and I'll be your host this evening. I'm very honored to be joined by Dr. Patricia Koh from Icon Cancer Center and Colin, who's lead of advisory here at MoneyOwl. So welcome, and thank you for joining us at MoneyOwl's Prevention is Better Than Cure Cancer webinar. Before I hand the stage over to our speakers, do give me a few minutes to introduce MoneyOwl to you. Okay, firstly, we are a social enterprise and we aim to help Singaporeans improve their financial well-being so that they can live the best possible life. We are Singapore's first bionic financial planning platform. This means that we take the best of financial planning methodologies and power it with a combination of innovative technologies and human capabilities. We strive to always provide comprehensive, competent, and conflict-free advice. I say comprehensive because we provide insurance, investment, estate planning, and comprehensive financial advice that's integrated with national schemes such as the TPF. Client advisors here at MoneyOwl are fully salaried and they don't take commissions. So this means we can help our clients find the most suitable and effective financial solutions. We are a one-stop shop that can help stretch your dollar. Since our funding, we have rolled out rebates and promotions to help clients find low-cost and high-value financial solutions. So we are the youngest NTUC social enterprise and we're here for the long haul. Collectively with the other brands that you are familiar with, we aim to create a greater social force to do good for Singaporeans and enable all of us to live better and more meaningful lives. If you're interested to find out more about MoneyOwl after this webinar, you can hop on to moneyowl.com.sg. Okay, before I introduce our first speaker today, let me run through the format for this evening. So during Dr. Koh and Colin's presentation, you can type in your questions in the chat. And at the end of each of their sharing, we'll take as many questions as we can before we move on to the next segment. And without further ado, I'd like to welcome Dr. Koh, our first speaker for this evening. So she has over 20 years of experience and is now a medical oncologist at Icon Cancer Center. Dr. Koh will be sharing with us more about common cancers among Singaporeans and how we can reduce our cancer risk. Dr. Koh, please.
Thank you, everybody. Thank you, MoneyOwl, for inviting us, especially for giving this talk. I hope to provide some very simple and quick insights of what we can do to prevent cancer. May not be foolproof, but we shall do our best with whatever means we can. So I will share my screen. I hope everyone had dinner. All right. Okay. Where's my, so Joseph. Okay. So as we know, the theme of this webinar is prevention is better than cure, and I've been asked to cover the two most common cancers in males and females population, so breast and colorectal cancer. And this is the general overview of my talk today. I'll first briefly explain what is cancer, why is cancer a problem, so what indeed is breast and colorectal cancer, what are the risk factors for cancer, and how do we prevent cancer, or is there any means of us preventing cancer actually? Apologize for my voice. I just recovered from a cold, so if I'm not too clear, I'm sorry about that. Okay, so what is cancer? The normal process in the human body is such that the human cells will grow and divide new cells as the body needs them. However, when cells grow old or become damaged, the new cells will take their place. So usually what will happen would be that there's equilibrium of self-growth and self-death. So this is the normal process, and when your body is in a good, healthy state. In the cancer process, however, what happens is the body's old or damaged cell will survive instead of dying. And these new abnormal cells will then form instead of dying, and then a tumor or group of cells will be formed. These tumors can be benign, meaning that they have no ability to spread, or they can be malignant, referring to the ability to spread. Okay, so this is what happens when the cell death is outnumbered by the abnormal cell growth in the cancer process. Okay. So how common and how serious is cancer? In general, actually 1 in 3 of us will get cancer, and 1 in 4 of us will die from cancer. So it is extremely common and it's extremely serious. And cancer is actually the leading cause of death worldwide, making up 13% of all deaths worldwide. In Singapore, it actually makes up approximately 28% of all deaths, so even higher than the global statistics. So in Singapore, estimated cancer deaths, although this is the cancer registry in 2010 data, the updated data is also looks approximately the same. In men, lung cancer is actually the most common cause of cancer death, followed by colorectal cancer. Sorry, the numbers have kind of gone off since I shared these slides, so it's meant to look like this. So in women, breast cancer is the most common, followed by lung and then colorectal cancer. Oh dear, what has happened? Okay, so as you can see from this slide, the top 3 most common cancer in men are colorectal cancer, prostate cancer, and lung cancer. And colorectal cancer is the second highest cause of cancer deaths in males. In females, female breast cancer is the most common cancer in Singapore, as well as the most common cause of cancer death in Singapore. So this is all the same as what I've gone through, the top most frequent cancers in females. So I'll go on to talk more about breast cancer. So this slide shows us the incidence and survival rates of breast cancer in Singapore. As you can see, the incidence of breast cancer has been steadily increasing in Singapore over the last 20 over years. But fortunately, the 5-year relative survival rates have also been increasing, which means that medical science is catching up, we're doing better, and also more women are aware of screening and early detection for breast cancer. This is to show that early breast cancer is diagnosed in most breast cancer women. About 10% are diagnosed in the late stage. So these 3 columns are what we still consider early stage, stage 1, 2, and 3. And stage 4 is when the cancer has spread. And really, we want most of the cancers in stage 1, if not stage 1 and 2, and fewer women in these two categories. And as you can see, things haven't changed that much over the last few years. And we are hoping that with more awareness with Breast Cancer Month and promotion of mammograms during Breast Cancer Awareness Month, we could get these numbers down and move more cancers into the early stages. And why is it important? Because actually breast cancer is one of the more curable cancers. As you can see, breast cancer is doing quite well in terms of the in terms of survival. It has one of the best cure rates among these cancers listed here. So what are the risk factors for breast cancers? I'll break these risk factors up into factors that we cannot change and factors that we can change. Obviously, one of the factors that we can't change is that is our sex. Being a woman or a man, at least biologically, we can change our gender nowadays, but not biologically. So the biggest risk factor is actually being a female. 1 in 8 women in the US will have breast cancer. The older age is another risk factor that we cannot change. Every year we get 1 year older, the numbers of candles in our cake will increase, and we can't change that. Okay, so if you're less than 45 years old, 1 in 8 women will get breast cancer. But when you're more than 55 years old, 2 in 3 women will get cancer. That is very frightening. That is a very high statistical chance. All right. So that all the more important in my next few slides later when I talk about screening. Family history is also very important, and it's one we can't choose our relatives. We can't choose which family we are born in. So women with close relatives who have been diagnosed with breast cancer have a higher risk of developing breast cancer. So what do I mean by that? If you have had one first-degree female relative, sister, mother, or daughter diagnosed with breast cancer, your risk is actually doubled compared to the general population. If 2 first-degree relatives have been diagnosed, your risk is actually 5 times higher than average. So again, if you do have a family history, you should talk to your GP or a specialist to seek advice at how you should do screening. I put this as one slide. Hereditary breast cancer is another talked about risk factor. In truth, not many, only about 5 to 10% of breast cancer are truly hereditary, meaning it is caused by abnormal genes that are actually passed from a parent to child. And most of the inherited cases of breast cancer are associated with mutations in 2 genes called BRCA1 and BRCA2. And as we know, these 2 genes are made famous by Angelina Jolie, who does have one of these mutations. Women who are diagnosed with breast cancer and have one of these breast cancer mutations often have a family history of not just breast cancer, other cancers such as ovarian cancer, stomach cancer, pancreatic cancer, womb cancer, which is uterine cancer, colon cancers, or have relatives diagnosed with breast cancers at a young age. So it is sometimes important to talk to relatives at Chinese New Year or family gatherings, because it is good to know who has what cancer, so as to have a gauge on your risk factors. Other things that we can't change our race. Fortunately, Asian women are slightly less likely than white women or Black women to have breast cancer. This is actually probably something that it is ambiguous. Okay, so prior radiotherapy to the chest or face, this usually happens in patients who have been diagnosed with another cancer such as lymphoma, and they've had radiation treatment that can't be avoided to the chest or to the face. And generally, this could lead to increased risk of breast cancer later on in life. Again, breastfeeding history is also, maybe it is a risk factor that we can control, but I guess as mothers, you feel that if we can, we will breastfeed, and breastfeeding can actually lower the risk of breast cancer, but only if you breastfeed for more than a year, which is a tough task. Even I couldn't achieve that. The other thing would be other risk factors that can reduce risk of breast cancers: being pregnant having pregnancies before age 30. And also women who start menstruating younger than age 12 have a higher risk of breast cancer, and the same for women who undergo menopause when they are older. This is because the breast cells have a longer exposure to higher levels of estrogen, resulting in a higher risk of changes in the breast cells. So these are risk factors that I'll move on to now another group of risk factors. I'll call them lifestyle related factors, which are actually factors that we can change. And actually this is quite generic. These are for many cancers, in breast cancers, as well as in colorectal cancer, which I'll talk about later. So smoking, and smoking, of course, can cause many cancers, in particularly lung cancer, but also in breast cancer, colorectal cancer, cervical cancer, head and neck cancer, whole list of cancers. So the best is not even to try. In fact, vaping is also now considered a risk factor for lung cancer. So vaping is considered another form of tobacco. Alcohol is also recommended not to overconsume alcohol. A recommendation is 2 alcohol units for men and 1 for women daily. I would say that there is no such thing as I can save my credits for the end of the week. So doesn't mean that you haven't drunk for 5 days. On Saturday, you can drink 5 units for women and 10 units for men. Actually, binge drinking is actually worse. It's actually worse. Okay, so no saving of credits. Obesity is another risk factor. So high body mass index in both men and women are significantly associated with higher deaths from cancer. A diet high in red and processed meat is ambiguous. Okay, there is some possible evidence, but not very strong evidence. The last one, however, is extremely important, and I actually advise my patient, all my cancer survivor patients, to take note of this. Physical inactivity. It is strongly associated with cancer and also cancer recurrence, and can reduce the risk by approximately 25%. And now Health Promotion Board has come up with a list of what we call physical activity, and it is at least 30 minutes of moderate activity for at least 5 days of the week. Now, if you haven't started any exercise, go slow, that's fine, but try and build it up to that. And you also get a lot of other health benefits apart from reducing your risk of getting cancer, not just breast cancer or colorectal, other cancers as well. So those are the risk factors that we can we have and we can't change, and those factors that we can do something about. And one of the other things that we can do about for breast cancer and colorectal cancer is also screening. So what is screening? Screening is actually undergoing tests when you are actually well. It's not undergoing tests when you're unwell. That is actually called getting a diagnosis. Okay, so you hear a lot of people say, well, I'm well, my blood test is fine. Why do I have to go for any screening test? That's actually precisely why you go for screening tests, because you're well and you want to detect early cancers that are otherwise missed. And as you can see here, early detection is vital. A screening mammogram can find cancers that are extremely small as a pea. Okay, by the time you can feel a small thing in your breast, it is almost the size of a cherry, which is about 1 to 2 centimeters, or probably more closer to 2 centimeters. And as the cancer grows, there's always a risk of the cancer spreading to the lymph nodes or to other parts of the body. And that's why the smaller the cancer when it's detected, the better it is, and that's why early detection is vital. Okay. And the other very important thing about breast cancer is that many times most of my patients will have no symptoms, because by the time it grows to this size and you have a little bit, you can feel something, it is this size. Or if you have a spread, which is not what we want, you can have pain. That would be when it's late stage. And again, that's not how we want cancer detected. So you can see B1 cancer detected when it's non-invasive or in stage 1. This is in most cases, this is stage 0 when the cancer is what we call DCIS or ductal carcinoma in situ, whereby it's only invading, it's not invading any of the lobules, it is just at the surface. In stage 1 to 3 cancers, it is invasive breast cancer, whereby you can see some invasion into the breast and into the surrounding tissue. Okay. What we want to avoid is what we call stage 4 breast cancer, whereby the cancer has spread to different parts of the body, lungs and liver. So how can we screen breast cancer effectively? By using breast cancer screening mammograms, we can reduce the mortality by about 25%. And this is how mammograms are done in various fields. Okay. So breast screening, who should undergo screening and when do we undergo screening? The Singapore screening guidelines from 2019 are that at 50 to 74 years old women should have mammogram once every 2 years. 40 to 49 years, a doctor should discuss with them, and if a patient is deemed to be suitable for screening mammograms starting from age in their 40s, then their mammogram should be done every year. Clinical breast examination should not be used to replace screening mammograms in patients who are aged 50 and above. The American guidelines are a bit more aggressive. They actually state that 44 to 54 years old should have an annual mammogram, and 55 to 74 years old once every 2 years. This is likely because the risk of breast cancer is higher in white women, and in Hispanic and Black women, as I've shared with you earlier just now. So there are also other women that we consider at higher risk, and there are different breast cancer guidelines for these women. So if you're at higher risk, it's important to talk to your doctor, again, whether it's a breast cancer specialist, breast surgeon, or a GP, but if you feel that you could be at higher risk. Such risk factors could be that you know that you have a BRCA1 or 2 mutation, or you have an untested family member of someone who has a BRCA1 or 2 mutation, you have had a history of chest radiation, which occurred before age 30, and you have a very strong family history. Okay, so if you can identify, if you feel that you may possibly have some of these higher risk factors, you should talk to your GP or a breast surgeon, a breast specialist. So in Singapore, we do have a breast cancer screening program since 2002. It's called Screen for Life. Women aged 50 and above are encouraged to have mammograms once every 2 years. And from recent reports, only 35% of women do undergo breast cancer screening, and ethnicity and socioeconomic group play a large part. Okay, I think I'm going too slow, so I got to speed up a bit. Okay, but what I want to emphasize here is that screening is actually not a one-off test. So if you want to have efficacy from screening, you need to actually undergo screening every year if you're 40 to 49. And if you're over the age of 50, you need to undergo every 2 years. Doing it one-off is not going to help you go have early detection of breast cancer. So I'll just go on to say that there are multiple treatments for breast cancer depending on your stage: chemotherapy, hormone therapy, targeted therapy, or radiation therapy. And I'll go on now to the other cancer called colorectal cancer. And what is colorectal cancer? Now, it is just simply cancer that occurs in your rectum, which stores your stools, or your colon, which the function of which is to absorb into your body what is not required. Okay. Now, in general, what usually happens is that this is normal colon cells. After many years, if you have abnormal gene, abnormal cell growth, which is what I showed at the start, this is still considered, you can form what we call adenoma. Now, this is still a benign tumor, but if it's left behind for longer periods of time, then more mutations will occur and what you'll get is actually a colon cancer. And this picture, this graph is, or this pictorial timeline is actually very important, because this is the basis of why colorectal screening is very important. Because there is a part here where it is benign, we need to catch the cancer at this, we need to catch it at this part before it becomes a cancer or malignant tumor. Okay, so again, what are the risk factors for colon cancer? Very simple. It's very similar to breast cancer. Aging, okay, it increases with age. There are some genetic factors as well for colorectal cancer, called familial adenomatous polyposis or hereditary non-polyposis colorectal cancer. As you can see here, again, it's very rare, less than 1% or 3 to 5%. Inflammatory bowel disease, such as what we call Crohn's disease, ulcerative colitis, also predispose one to colorectal cancer. But this is actually quite uncommon in our population, more common in the Western population. Or past history of benign adenomas also increases your risk. Again, a big slide on family history. No genetic mutation, but the fact that you have family members with colorectal cancer. Now, if you have no one with colorectal cancer, this is your baseline risk of 4%. If you have one first degree, again, immediate family, mother, siblings, then your risk increases to 9%. If you have more than one, again, increases to 16%. Quite similar to breast cancer, as I have shown you before. In here, if you have one relative that's diagnosed with colorectal cancer before 45 years of age, your risk increases from 4 to 15%. So family history is quite important, all right? Again, this is the slide that I shown with breast cancer. It's very similar, and I won't go through this again, but just say smoking, alcohol, obesity, and physical inactivity are 4 things that we can do something about. And if anything, I'll say quit smoking, drink less, start exercising. These are the things that we can do for general cancer prevention. If you remember nothing from tonight's talk, just these 3 points is good enough. So again, how can we detect early colorectal cancer? And colorectal cancer screening is how we detect early colorectal cancer. And so what are the methods that we have? I like this slide. This from actually Singapore Cancer Society in 2013. So don't flash your early detection away, because it could save your life. So again, very simply, the aim of colorectal cancer screening is to prevent the development of colorectal cancer by finding its precursor. Remember the polyp or the benign tumor that I showed you before in that diagram, and therefore increase the likelihood of cure by early detection. So in Singapore, the colorectal cancer screening started as what we call integrated screening program in 2011. Screening should start at age 45 to 50 for average risk patients. Our screening program recommends screening from 50 years of age. But if you have any family history that you feel that puts you at a higher risk, or history of inflammatory bowel disease and so on, again, you should talk to your GP or a specialist to consider earlier screening. And what are the methods that we can use for colorectal cancer screening? So one of the methods that I'm showing you here is what we call the stool or cord blood stool test. Now, this is a simple stool test whereby you're given a kit, you probe it into your stool, you put the stool back into the kit, and you send it off. It's widely available from Cancer Society, from Guardian, and then from any laboratory, okay? The idea of this is that it detects very small amount of blood in the stool, as early stage cancers bleed only a small amount and cannot be seen by the naked eye. That's the disadvantages of this is that about 50% of the cancers are actually missed, and it does not detect the precursors, which are the polyps, and it needs to be done annually. But of course, the good thing about it is that it's a simple test. Okay, so as long as you can remember, if you can remember to do it, you don't, you find it convenient, then this is a possible stool test that you can do. However, the gold standard of colorectal cancer screening is actually colonoscopy. What is a colonoscopy? A colonoscopy involves, is actually an invasive, it's a more invasive procedure. You actually need to be admitted to hospital for for half a day or so. You need to take what we call a bowel prep. You need to clear your colon and your rectum of stools, and then the doctor will put you under sedation, put you to sleep, and they'll put a telescope with a camera at the end, a flexible telescope with a camera at the end, and this camera will visualize your entire colon. Okay, the aim of it is to be able to look for benign polyps or benign tumors that I talked about just now, which could after 5 to 10 years become malignant polyps. So as you can see here, this is a benign polyp. If a doctor sees that when they're doing the colonoscopy, they'll remove this benign polyp, and this will prevent this from happening. Okay, invariably, any benign polyp that is left behind for over years, it will become a malignant cancer. And hence, colonoscopy is considered the gold standard, and this is how cancer can be prevented. So for a stool test, we can use it to detect early cancers, but it cannot prevent colorectal cancer. But for screening, colonoscopy, we can actually prevent colorectal cancers, as well as detect early cancers. So in the last couple of minutes, I'm actually going to make it. So in the last couple of minutes, I'll just share with you how usually colorectal cancer are diagnosed. Are there any symptoms? There are some symptoms. Some patient may present with blood in stools, change in bowel habit, meaning that if you're a regular person, you suddenly become very constipated. If you become very easily tired, this could indicate that you're anemic because you're losing blood in your stools. Shortness of breath, if you're losing weight or you're getting pains in the stomach, and you go and see the doctor will suggest that you do a colonoscopy, and if the lesion like this is seen, they will take a small amount of tissue for examination under the microscope to diagnose the cancer. And after the cancer is diagnosed, then you get scans done and blood tests. All right. And sometimes it is, as we say, early detection on a screening colonoscopy can be achieved. And how is colorectal cancer treated? Again, depending on the stage of the cancer, one can use one of these modalities, such as surgery or chemotherapy or radiotherapy. And I think my time is up, and I'd like to thank all of you for your time, and hopefully you have you take home some key points. And as I said, there's only 4 key points. One is don't stop smoking or don't smoke, drink less alcohol or don't drink alcohol. Okay, I wouldn't say don't drink alcohol, drink less alcohol, start exercising, and go for screening if you are eligible for screening for breast cancer, for colorectal cancer, and for other cancers that I haven't touched upon. And with that, I thank you. I'll take any questions if there are.
Okay, thanks, Dr. Koh. I personally found the sharing very useful, and I'll definitely take away the points on exercising more, smoking, not starting to smoke, and not drinking too much. So we started to receive some questions from the attendees, so I'll ask you some. So I think the first one is a common question. So when we go through house screenings, usually there are cancer markers tests also being done. Can you tell us a little bit more about that?
Okay, so tumor markers are actually not screening tests. And if any patient comes to me, I actually would tell them that these are not screening tests. It's actually only in Singapore that we widely use, that we have tumor markers done as health screening tests, because they are not sensitive, nor are they specific. Okay, they can be raised due to other reasons. Okay, but of course we have seen patients who are well and their cancer detected on cancer screening. You hear of friends or here and there. Naturally, you will have some, but if you're talking about a population-based screening method, tumor markers are not a recommended test. And even if you do the other thing about tumor markers is that it gives you a false sense of security. So you may have a tumor marker that is positive, that is negative, and you think, oh, great, I don't need to go for a mammogram, or I don't need to go for a colonoscopy or a stool test. That is false. If it's normal, it does not mean that you have no cancer. It is only if it's abnormal that suggests that you may have cancer. And in some patients whereby the cancer marker is slightly raised, we may end up doing many tests and we may not find a cancer, okay? Because as I said, some of these markers can be raised due to other reasons, okay? Yeah. So for me, I'm not a fan. I would state that it is not a screening tool at all, okay?
Okay, thank you very much. So the second question we have, do women have higher risk of cancer than men?
No, but we have certain organs that predispose us to more cancers. But I think, yeah, and so does men. Men have prostate cancers, or we have ovaries, and we have uterine, we have the womb, and we have cervix. Men have can have breast cancer as well. It's just not as common because their breast glands are not as developed as women. Yeah.
Okay. Another question is whether there's a need to remove a breast lump if it's benign.
If it's benign, there's no real need, unless some of the benign conditions do predispose, and if you do, your breast surgeon will advise you accordingly.
Okay.
Yeah.
I've got another question. I think it's something that most of us will think about also. Whether stress has a correlation to cancer?
Yeah. Well, I wouldn't say no, but I wouldn't say that we have strong evidence to say that it does. Okay. So it's just very hard. If you're talking about hardcore scientific evidence, it's very hard to measure stress. So there will never be a scientific study to show that stress actually causes cancer. So if you're asking, if I put on my scientist hat, I would tell you that there's no hardcore evidence that shows that. Because we are not able to do such a study. Yeah, because stress is very different for different people, basically. Yeah.
Understand. So I've got another question. I find this question a bit amusing. The person asked whether drinking lots of water after a drinking session will dilute the excessive alcohol intake.
No, there's no such thing. No, just like you cannot binge, save your credits is the same deal. No.
Okay. Another question is whether taking probiotics or drinking vitagen regularly will help to prevent colorectal cancer.
Okay, so again, there's no real clinical evidence at this point in time. It does probably improve your gut health. Maybe it makes you go more regularly and so on, helps you feel better. But, there's no real hardcore evidence to show that it does reduce colorectal cancer. Yeah.
Okay, I think in the interest of time, we'll just take one last question from the audience before we move on to the next speaker. So, somebody asked, for breast cancer for women above 30 years old and above, what's the screening frequency for this group?
Okay, so there's you shouldn't be doing mammograms if you are of normal risk, okay? So I'm assuming you're of normal risk, you don't have a family history, you're not of the high risk population. 30 years to 40 years old, you are not, you don't undergo a screening program. The only thing that you should be doing is clinical self-breast examinations. But of course, if you have some breast conditions and you see a breast specialist and they advise you to do some ultrasound, then that's different, okay? But for the normal population, just clinical self-examination is sufficient.
Okay, thank you so much, Dr. Cole.
Thank you for having me. Hope you all gain some knowledge, and hope you all have fun listening to the next talk.
Yes, thank you so much for your sharing. I hope you found, I myself found it useful, so I hope the audience also found useful takeaways that they can take home and implement immediately usable one.
Okay.
And now, now I shall pass on to the second speaker of tonight. He is our lead of client advisory at MoneyOwl. Yeah. And then Colin, he is a certified financial planner with 7 years of wealth advisory experience. So in 2018, he was actually awarded first place at the Financial Planning Awards in Singapore. So now Colin will take us through how we can build a financial contingency plan. Because while we can reduce the risk of cancer, we can see how we can use insurance to give us peace of mind so that we can go through treatment without worrying about our finances. Colin?
Thank you, Daphne. So hi everyone, happy to be here to share. I just want to share with everybody uh, the focus of my talk. It sounds like it's going to be focused on insurance, but I want to just share with everyone and just tell everybody actually it's much more than that. Yeah, insurance is really a part of our whole entire life plan. All right. Okay. And as a disclaimer, all the advice that we hear, the tips, the hints, the tools, these are really something that you can take home and reflect on. But at the end of the day, it is always good and important to seek advice from a professional. Okay. So I just want to have this disclaimer out there. The first thing I'd like to share with everybody today is at the end of the day, I mean, when we think of all the different um, causes of cancer, illnesses. It sounds like it's so dark and difficult. But let's focus on the real reason why, we want to learn and why we are here today. And let me start by sharing with my own personal story. Okay. So this year, once COVID restrictions were lifted, my family and I discovered that there is a river in Selangor that was 7 km, and there was actually this a way of a kind of an experience where you can do it with your family. My daughter is in primary 3 and my son is in secondary 1, and so even though at primary 3 we were able to do this 2.5 river rafting, and it's a very um, wow experience. And I want to just tell everybody here, not just to consider bringing your family there or you yourself experience it, but also that actually the river to me represents life. Okay. And while we are talking about all these things about cancer prevention, we also need to understand that the entire life that we have has different moments of time where we need to make important decisions. Okay. So the first thing I want to share is, well, do we have a life that we want to protect? Do we have a life that we cherish? Do we have a life where we have loved ones beside us? What is the value of the life that we have lived? I think that is the most important thing, all right, to think about before we embark on our journey down the river. Okay. And the one thing I want to just share with you about this is after all the rapids and the many drops, okay, at the end, you will actually go on this, on the bottom side of the slide, you will see me and my wife actually at the last part of the river where everything is slow and we are just floating and letting the river of life take us to the place that we would like to be. And it's really interesting because now that I think about it, that is like how our golden years, when we have lived the life worth living should be like. Okay, so I hope that's something to start off the talk about. All right. On this note, I would like everybody, all right, to take part in a little poll. Okay, it is a true or false, and I'm going to start the poll, and everybody can take some time. And what is interesting is, Dr. Patricia has actually already mentioned some of these things. So let's see how everyone is doing. All right, well, let me begin to start the poll. All right, here you go. All right. Yes, everybody, let's take part in this poll. All right. And I will give you the answers once we get more. Yes, I see. Yeah, just click through. All right. Yes, and take your time. All right. Yes, I see numbers coming in 5, 6, 7, 8, 9 out of 100. All right. That's nice. Yeah. So if you can take your time to just look through 6 easy to answer questions. All right. And then we'll see whether, well, how we are doing. Singapore is the exam, and I think this week happens to be PSLE. So everyone remember how PSLE, right? Your teacher come and test you. Okay. I hope any parents, I doubt any parents here have kids now, right now in PSLE, joining this webinar. All right. I've done my dues. Okay. So, okay, wonderful. Oh, that's almost, excuse me. And I would like to also tell everybody that 3 weeks ago, I just recovered from COVID. Okay. So I am actually recovered and healthy and all that, but I had this persistent cough. And when I'm too excited and I talk, suddenly I will cough for no reason. Okay, I just want to let you know, okay? Please forgive me if I do that. All right, looks like we are, once I hit the big 80, I will stop the poll. Okay, now we are very close to 74. I know some of us are taking some time, okay, to go through it. So I just wait just a little bit, okay, to get everybody in. All right, yes, we are close to 75, 76%. All right, looks very close. Okay, good. I'm going to end the poll now. Okay, let's see how the results. Let's do it. Okay, great. Poll is ended. Let me share the results with everybody. Okay, are you seeing it? All right. Okay. Okay, so you can see only heavy alcohol use increases cancer risk. False. Okay, so let's see. Later I'll go through. And stress makes cancer grow. Okay, true. Oh, all right. Working at night increases cancer risk. Oh, this is quite divided, right? Very close. Some people say true, some people say false. And then on number 4, brushing your teeth can help. Oh, I have quite a number says false. Okay, 71%. Chances of being cured of cancer are good. All right. Wow, many people have put true, 82%. Okay. And red meat increases risk for all types of cancer, all types. And many say true. Wow. All right. So this is a very interesting result. Allow me to share. Okay, so I'm going to pull the results down so that I can talk as I present my presentation. Okay, so the first question is only heavy alcohol use increases cancer risk. All right, and the answer here is false. Okay, even small amounts of alcohol increases the risk. Okay, and then affects this one particularly breast cancer. In case you may be wondering where I get all my resources from, I will show you the source of the question and answers that you're seeing here today. It's an excellent book. I picked that up from the National Library, so I hope you can all also learn more from that book. All right. For this one here, every 70% of you said false. So excellent, right? You're on the right track. Okay. The next question is stress can make cancer cells grow. Okay. True. Oops, sorry. I think I just many studies have shown this. And what was interesting is the doctor just before mentioned that it's hard to determine the studies and all that. But not to worry, this is just a source of where I took it from, and I'll share more about it later. Okay, we can differ on this. I mean, just to highlight, the doctor said previously that it's tough to do these studies. Yeah, but it's okay. At least you know that stress. I mean, for those who have gone through cancer treatment and all that, most of the time when I speak to them, they do agree that it is true in some extent. All right, the next question is working at night increases cancer risk. This is something very interesting because MoneyOwl, we have many advisors and even our CEO working late at night. Okay, so I just want to share with you. Let's take a look, and the answer here is true. Okay, so it seems to come from data they have taken from night shift workers. All right, so this is just one study. Okay, so you can read the book to find out more about this. And the next question is, brushing your teeth can help prevent cancer. I read this in the newspaper and I thought maybe it's an urban legend. And true enough, let me see. Yes, majority of you believe, 71% of you believe that this is false. And according to the research, apparently it's true. Good oral health can reduce risk of cancer. Okay, don't shoot me. Okay, this is from the book that I've read. Okay, the source I'll share with you later is actually at the bottom of the of the page. Next one, the chances of being cured of cancer are good. Okay, this is something that is very important to differentiate, okay, fact from what this is trying to say. Is there really a cure for cancer? You see, this is something that we need to come to terms with. And the answer for this one is false, okay? Now, basically what they are trying to say is that basically the studies are not clear about this because most of the determination of whether the cancer is, has regressed and all that, and then it really takes a study of 5 years. Yeah, anything more than that, 10 years, 20 years, there isn't a proper study. So apparently, yeah. So this is just what I read from the book. Okay, the last question. Red meat increases the risk of all types of cancer. Very popular. And it's interesting, the answer is true. But the actual one in the book says false. And the reason is because the study was only based on colon cancer, so there's no evidence yet of red meat affecting all other types of cancer. Okay. All right. With this in mind, I just also want to share that if you look at all of these, all of these questions that I posed here, right? I hope the mist at the back of this younger, becomes clearer. Life is sometimes like that. You're not sure of things. As we do the webinar today, I hope it becomes clearer. But the next slide I'm going to share with you is something, another 6 questions. Okay. And in this, okay, I think we are going to have to pause here. I'm also looking at the time. I have prepared this question, but I think we will do it as a poll. So let me just show and go through the answers. Genetics accounts for 50% of cancers. Yes, there is some relationship, but the studies have shown that it actually accounts for less than 30%. What I'm learning from this is that it doesn't mean that your mom and dad or relatives have cancer, you have a high chance. But if they don't have cancer, then you just relax. You don't have to think about it anymore. No, it still is important to be aware of the screening. Next one, cancer risk changes as you get older. This is true. Okay, there's evidence to show, and also there are studies by the Singapore Cancer Society on this portion. Now, family cancer history isn't important. Unfortunately, not true. Right? One of the best genetic tests of cancer is family history. The next one is you can't screen for most cancers. Oh, apparently this is true. Because you can only screen for some cancers. Okay, this is something also to be read, from the book to understand this better. Last one, women are more likely to die from cancer. This is something I wanted to ask in a poll, but we didn't have time. Apparently it's false. Women are less likely to die than men. So I think the studies show that women are just resilient. Yeah, I mean, most of my relatives, the men go first. So the women are very resilient. That's all I know. It's a fact of insurance. It's a fact of claim. Okay, you can also take a blood test to detect cancer. So this is something related to the cancer markers that we talked about. Every time you go for screening, there's a question, you can take your blood to check for this. Apparently, this is false. This is in alignment with what the Dr. Patricia mentioned. We do not have a blood test to detect cancer. So on this note, this book here that I referenced from it's very interesting. You should read it. It's very easy to read. There's no jargon, and it's from this WebMD. He's the chief medical officer on this website. Okay, so I think the source of information here should be quite good. All right. So with this in mind, I want to just end it. Do you all realize that at the end of the whole picture there is really about this very wonderful show called Stranger Things? To me, cancer and all that is like a stranger thing. All these things that it happens to you is really out of the ordinary. Okay, and you know that it's about that. So life in Money Hour is really about life. Okay, we want to make sure that we help people make the wise financial decisions so that you can really live your best possible life, no matter what circumstance that it is. So on this note, okay, I also put what are the factors. First is you, and you have your loved ones, your family. All right, and then you have your doctor to help you, in the event of any medical needs or cancer. And of course, last but not least, the one that people don't talk about is someone to just help you with your financial positions. I hope this is the 4 things can help you, I hope MoneyOwl will be that trusted financial planner for you. So today I just share with you, we will talk about risk proving your financial plan, and then we have a very, very critical personal sharing. Please stay on. This is the reason why we are doing it, because it's a very, very personal sharing from someone very special. Okay, and the third one is purpose of critical illness, and the last one is critical illness versus cancer insurance. How can you determine which fits your needs? Okay, so this is going to be what I'm going to share. So let's talk about how you risk proof. Now, in any financial plan and in any financial solution in Singapore, very often we always put the cart before the horse. What this means is we often start our journey in financial planning by buying an insurance policy, right? It has always been very common. Everyone starts talking and financial awareness through buying an insurance product. However, MoneyOwl, we look at it in a very different way. Okay, if the horse is going to really push the cart and the cart is right in front, the first thing I noticed about this picture is the horse cannot see beyond the person standing in front of it. Right? So this is very hard. Imagine we are the horse trying to push this through. It's going to be a very difficult journey. That's why at MoneyOwl, we have established a very, very simple to understand protocol on how we can risk-proof our financial plan. And this is what all our clients understand. The first thing is today, okay, for whatever age we are at, okay, we may have dependents, okay, but we all know that we are earning an income and we have accumulated a sizable amount of current assets. We have savings, we have a beautiful home, perhaps you still are paying a mortgage on, all right, and then we also have different investments that we may be doing. Now, because of this, and we may be still young, you're working, and as you work, you're earning a good income, and this income provides and enables your financial life. At this point of time, you'll be taking care of your loved ones, you'll be experiencing the river in Malaysia, all right, doing all these wonderful things because you're able to have a working income and spend it, right, and really enjoy yourself. But one day we will need to retire, and this is where, because we are working, we will be able to set aside some amount of money to have something called a future asset. This future asset is CPF, is our own investments, is our savings. And all of these coming together allows us to do three of the important things that are required for retirement. The first thing is have a good healthcare, have good retirement income, and by then our home should be fully paid off. This allows us to spend during our golden years the retirement income, allowing us to have a peace of mind to take care of these three things that I mentioned earlier. However, as we are working so hard, there might be there's also a legacy. But however, there may be we never know, touch wood, whether it's cancer, whether it's stroke, whether it's a heart attack, that prevents us from working. This is very important, and therefore, all our liabilities, somebody else needs to pay for them, or we might lose the house, right? Okay, all of these things will wipe out our ability to earn an income. Okay, and in this case, we have insurance. And in this case, we have MediShield Life and CareShield Life that's required by the government for citizens and permanent residents. But on top of this, right, I'll share with you later, there is actually good additional medical CPF approved ones. You can use MediSave to pay for these plans. Okay, I'll talk about it later. But these are actually for your healthcare bills. In the event you need to go for the hospital, pay for the bill, this insurance covers the cost and you don't have to pay so much. Now, after that, right, think about it. If you have and you're not working, if you're working and you're having you're working and then one day you have cancer, for example, then the question is, do you have enough to tide you over? All right, because you are unable to work, right, for a period of time, you need to focus on recovery. All right, and there will be a payout to help you tide over. So at MoneyOwl, we believe you should at least cover your working years first. That's the priority when we do insurance planning. Okay, therefore, having a lower cost of insurance, you have more surplus, okay, you replace your income when you need it, and this allows you to have a more surplus for a larger future asset. Okay, this larger future asset will allow you to really enjoy your retirement years. You can see this old man enjoying his skydiving trip, okay? And of course, we, at the end of the day, want to be able to live our golden years like the river that I mentioned. I was floating at it after the wild rapids of life. And that's where we want to make sure our money lasts longer than us. In this case, a local actor, Mr. Payan, okay, passed on at 100 years old, okay? And then we really want to make sure we have a sufficient and reliable retirement income for a lifetime, okay? So at any junction, this is the last part I want to share about, okay? For critical illness, many people are always struggling. Should I need it during the retirement? Yes, at Money Hour, let's take care of the full picture first, and then critical illness can come in as a later discussion, right? So remember about the horse before the cart. The horse should be pulling the cart, not the horse pushing the cart. All right, with this, let me share. Oh, okay. I'm going to have to skip some of the questions, some of the slides that I have. There are 37 critical illness. There are also evidence to show from NTUC income. They post their claims. About 50% of all life insurance claims are critical illness related. Okay. And I'm going to quickly go through this and invite our guest speaker. All right. And we are very blessed to have her. Right? Yes. Is Neha with us today?
Hi, Colin. Yes, I'm
Oh,
here.
hi. Well, it's nice to see you too. I read about you on CNA, your article and all that, and you look radiant. You look radiant.
Thank you.
Thank you. So yes, let's start. Could you share a little bit about yourself?
Yeah. So actually, me and my husband, we moved to Singapore about just before lockdown started. Before this, we had a life in India. And, we were about married for about 3 years, and we got an opportunity to move here. So it seemed like the next big adventure. We were pregnant at that time with our first baby, and totally excited about life. And we moved here in December 2019, and April, we had a baby boy. And professionally, I'm an HR professional, and my husband is in banking. And, life seemed set. And unfortunately, in August of 2020, around the time of lockdown, I was detected with metastatic breast cancer, which means stage 4. I think since then, my journey has been very different. And, for the last 2 years, we've been in treatment. And yeah, I think that's how life has been so far.
Yeah, so Snehal, thank you for setting the context. When I read the article and also hearing from your sharing, the birth of your son, right? And actually reading that part really hits me, right? Because I understand. So I had one question. I think you answered it with a very short line. Yeah. So I just ask it. Okay, what was on your mind the moment you were told you had cancer?
So honestly, I think my first reaction, I didn't believe it. There's no history of cancer in my family.
Oh,
I did not know anyone who had cancer. So it just seemed like unbelievable, right? Like it's like almost they're talking about a stranger.
Yeah.
The next thing I felt was that I'm going to die. That was my first reaction, that this is it. And the thing is, you always hope that, maybe we've caught it early. Right. And you feel that, okay, it might be like a stage 0 or something of that sort, we've got it. And as soon as she said metastatic, and it just, threw me off guard, that how could I have detected it so late? How come it just, nothing? There was no sign.
No sign.
There was absolutely no sign.
No suspicion. No suspicion. No suspicion.
Oh. No lump. Usually what we would feel. I was breastfeeding at that point of time, and my milk supply started going down in one breast. And that was the only reason I decided to go to a lactation consultant. And she thought it was mastitis. Even she couldn't figure there was something else. But when the doctor did an ultrasound, that's when we figured that maybe it's something else.
Yes.
So, I think it was shock that I'm going to die. And, then you start reading a little, and I realized that, the minute chance that I had of getting cancer. So, in breast cancer, women below 40, only 7% of breast cancer patients are below 40.
Oh, okay.
And I was in that 7% of an already small population. So it almost seemed like I was the chosen one that time.
Okay. Yeah. So And also, when your treatments and all that, right? I understand that you mentioned that you've gone through, let me see here, 30 rounds, 30 rounds, 30, not 13, of chemotherapy.
Yeah.
My aunt went through that. I've seen it, and it's tough. So yeah. So could you share a little bit more about the process and the treatments and all?
Yeah. So basically, I think I went, every person's treatment, every person's diagnosis is very different.
Yes.
And metastatic makes it a little more difficult because it's spread to different parts of the body. For
Oh.
me, it had spread to the lungs, the liver, and the bone.
Okay.
So what happens is sometimes chemotherapy works on maybe ABC parts of the body, but it does not work on some other parts.
Yes.
And then you have to keep changing treatment because maybe in that part it's increasing. And that's the reason I went through, almost 30. I went through some other treatments as well. That's called hormonal therapy. I went through radiation, and now I'm on another type of treatment. Basically, it's been 2 years since my treatment has started, and we still don't know. Actually, it's just we just got our latest PET scan and it says it's increased again. So basically, we still don't know when things are going to improve. And yes, 30 rounds of chemotherapy. Now I'm kind of, it's unfortunate, but I'm used to it.
Okay.
And I've said, like, I know how things will happen. But yeah, but the first time it happened, it was, I started physically changing, and nobody prepares you for the physical change that happens. You do see it on TV, you do see how things are with people going through chemotherapy, but when you see yourself going through it, it's torture. And I decided not to shave my head. Many people told me you should shave it off and stuff, and I said no, I'll just keep it. And I did something called as a cold cap, which just freezes your hair follicles and does not let chemotherapy drug attack the hair cells.
Wow. Okay, that I did not know exists.
Yeah. So I tried that, but it still makes you lose hair, which is maybe maybe you lose maybe 60% of your hair or 70% of your hair. And that was difficult, finding clumps of hair every day.
Right.
And then you look at yourself in the mirror and you think, who is this alien staring back at you? So a lot of things, you go through self-esteem issues, you go through body image issues. People tell you, oh, you have to love yourself through cancer. There's no other way. But how do you love yourself if you don't recognize yourself?
Yes.
If you don't know who is this person? So I think that was a very difficult time for me when chemo started.
You mentioned in the article also that at a low point you spoke to the Singapore Cancer Society and they helped you. Could you share a little bit more on that?
So I had spoken to a particular foundation where all breast cancer patients and women who are below 40 have a particular WhatsApp group, and there's this concept called as a befriender service there, where somebody journeys with you who has also gone through a similar treatment or diagnosis or treatment. So it just helps you feel less lonely, because when you don't know anybody, it's a very lonely journey. You feel victimized. You start blaming a lot of, on life. So I think it helped me because I saw women living normal lives. I saw women discussing regular things like cycling and herbs and, stuff like that. And I just felt that, okay, I am not abnormal. After a very long time, I started feeling as if, okay, I can breathe a little easy. There are other people out there like me.
Nice. And could you share a little bit on, how you initially when the treatments came, okay, I understand that you just moved here, so it's a little bit of a different context, yeah. But usually when we do planning for our clients, we're also very mindful that the idea of needing any form of insurance, of course, to pay for the bills, but the other portion of it is to be able to have them, just proceed to rest, get enough. So I'm just looking at the work related, and you shared with me in your writing earlier that actually you have heard of people actually still working, right? Still working and all that, right? So maybe, for yourself, right? Do you feel that people who are going through cancer stage 4 treatment, do you feel that they can really continue working and no need to stop, or you feel that at least stop a little bit, rest a little bit? Yeah, could you share a bit about that?
See, Colin, all this depends on
Mm.
the type of diagnosis that you have in the treatment. Okay.
Yes. Okay.
Nobody can say when you're going to get well, right?
Yes.
Your treatment has to be your priority.
Yeah.
Right. Okay. So
Yes.
there
Yeah.
is no two ways about that.
Right.
If you're able to keep your treatment a priority and you have a work environment which is supportive of you, maybe it's fine. Maybe you can do it. I have seen women go through chemotherapy and do it. There are some who take a sabbatical. There are some who leave their jobs. Maybe for some it is about financial also, because you have your corporate insurance available to you, as against maybe they don't have a personal insurance and they have to work at that point. So it's a very personal call. But I would always say, at any stage, your treatment and self-care has to be top priority. If it's adding to your stress, because you're working for something, right? You're working to live. You're working to live a good life. So
yes, that's true.
Absolutely
true. So thank you for that. And I would like to just share about this. What keeps you strong, in those trying times and keeps you going. And I understand you are a life coach.
Yes.
Yes. So that's amazing, right? Yeah. And you went and you studied and, being a coach and all this. Could you maybe elaborate about this part of your, sounds like a new phase of life for you and so exciting. Yes.
Yeah, that is true, actually. The first few months were traumatic, but I would say I got help very early on. I went through counseling. So a friend of mine from India, she, decided to counsel me. And my first reaction at that time was, I don't need help. All of us feel we don't need help. We all think we're mentally very strong. And I have been through a divorce earlier, and I thought I was mentally amazing and I could deal with this. But, as I started my journey with her, she really helped me deal with a lot of things. My first issue I think I was dealing with was that I was scared that people would judge me, looking at me. They would think I'm weak. They would think, what a tragic case, and you don't want to be considered as that. So she really helped me deal with that. And I think the next thing I realized is I have a great support system. So a lot of people, like my husband, my in-laws, everybody came out of the woodwork to help me out. And I remember my husband, at one point, my PET scans, and the thing is, in cancer, or at least what I have seen, a lot of us go into our shell. We put life on pause and we think, okay, once I am better, I will come out and I will be victorious and I will share it with the world. But that wasn't happening with me, right? I kept waiting. I was like, okay, maybe 2 months down, I'll be fine. Maybe 3 months down, I'll be fine. And that wasn't really happening. And finally, I remember my husband telling me that, you're living right now. Your chemo happens every 3 weeks. You have enough time to do something with your life. So just don't put it on hold. And that's when I really thought I should do something. And that's how I started studying, and I did certain certifications. And, I am as you said, I'm a coach and I'm a trainer. Basically, I'm doing things that I love, and I'm doing things which give me the flexibility in terms of my treatment. It doesn't take up too much of my time. It keeps me productive. It keeps me happy. And I think, that's the big thing, right? You have to be mentally in a good space.
Yes. So, so I would just let you know that to me, it's an inspiration. It's not easy. I have clients who go through this too. I never imagined meeting someone who's positive and living life, and all that, right? It's not easy for them. So I really, I'm inspired by what you're sharing.
Thank you.
Yes, and I understand you'll be with us later for the Q&A. Is it for taking? All right, great. So we look forward to that. If there are any questions that the audience would like to find out more about, yes, then they can come and ask about it. Yeah. All right, Sneha, really appreciate it, and thank you for being so brave, because we're looking around and most Singaporeans are very quiet. No. So, but thank you so much for really sharing this with the group. Yeah.
My pleasure.
Okay, great. Thank you so much. All right, so let me continue with my slide. Yeah. Okay. Yes. So if you want to read more about Sneha, please go to their this CNA. Yeah, there's a very beautiful article. It's very well written. A lot of information there. To just find out about how you can be inspired. Okay. Now I'm going to move on to the purpose of critical illness. I know this is a cancer talk, but I just want to talk about this because for many years of doing financial planning, a lot of clients come and say, that, oh, I need to get critical illness or cancer insurance because I need to pay for the medical bills. Now, remember at MoneyOwl, we want to make sure that everything makes sense. So the first layer is really having your hospital insurance, okay? Integrated shield plans, okay? And these are really your first line of defense. You can see from here that if you only have MediShield Life, there are many limitations, okay, for the different treatments that you see here. Radiotherapy, 300 each session, and then immunotherapy, then there's chemotherapy over there, $3,000 per month. Now, so if you purchase the what you call the integrated shield plan, you can see actually it's as charged. All right. So yeah, it does bump up the coverage. And for many people, when they are on the retirement age, actually they start realizing the importance of such a baseline insurance, to get. All right. Now, on another note also is that MediShield Life has limits. So on the right side, you can see the radio surgery. It's $10,000 each treatment. Okay. And then you also have pre-hospitalization and post-hospitalization treatment that is not covered by MediShield Life. I did not have space, but the integrated shield plan does have pre and post-hospitalization treatment covered. Okay. So that's the first misconception, that critical illness or cancer insurance is bought to pay for hospital bill. Yes, it can do so, but the first line of defense is still a very good hospital integrated shield plan, and this is very affordable. The next one I will talk about is that critical illness or cancer insurance pays for all the bills. Okay, this is also incorrect. Recently, the government has monitored the cost of cancer drugs, and has tried to reduce the insurance premium cost. So what they have done, this from MOH, is they have before September 1st, 2022, they have actually MediShield Life actually will pay before 1st September $3,000 per month, all right, for cancer drugs and integrated shield plans. All right. What they have done is they have studied and find the efficacy and also the cost of the drugs, okay, and made it different. So you can see after this, from 1st September, after each cancer drug treatment on the cancer drug list will have its own MediShield Life claim limit, all right, and you will also be able to see, okay, that this also affects, all right, the private insurance plans. Okay, previously this was not the case, but after 1st September 2022, okay, it will be affected, especially next year, April 1st. Okay, even integrated shield plans will be affected by this. Okay, now, okay, let me just put this here. Yeah. So you can see here, I just want to say that there are 48 categories with monthly limits from 200 to 9,600. And critical illness plans are in this respect, yes, your second line of defense. There are certain medications that may not be on the cancer drug list, and perhaps the doctor finds it useful for you. Yes, it might be a case where you need to pay extra, right? So on this note, yes, there is a possibility that cancer insurance or critical insurance can help cover this cost. Okay, so that is something to go on. So what is the main purpose of critical or cancer insurance? Is number one, income replacement. You get a lump sum to tide over the difficult period while you don't have to think about working to earn an income to support your family or yourself. All right, this lump sum will help tide over the difficult period. The next secondary is really the ability to seek alternative treatments, or as I mentioned, certain drugs may not be covered. You may want to get a certain amount that covers the cost. All right. So these are options for you. How long do you need? Now, for income replacement, if you are working and you are sick and not able to work, you need to replace it. So we will recommend at least during your prime years when you're working to cover until age of retirement, right? But in the case of alternative treatment, if you feel that you want to have this, in now and in the future, you might want to consider this as something as a whole life, right? So this is really an option for you. However, one needs to understand not just this, but that it costs more for the whole life option. So I'm going to show you an example of how much it can cost. So here is basically a 400K critical illness payout, okay, a coverage here. And what is the premium difference? Okay, for a whole life plan, pure whole life with no multipliers, it's almost 8,844 a year. Okay, but the premium of a term plan for the same amount of cover is only 1,380 per year. So on this note, the difference is high. Okay, now in the market today, you will not find it may not be a case whereby it's just there's no multiplier. Most of the whole life plans now have an embedded multiplier, which basically means you are buying an embedded term plan to make the cost lower. All right. So yeah, so things have been a little bit more different from previous years. All right. But these are things to just take note of. So how much really do you need? Okay, let me show you MoneyOwl's coverage guide. The first thing to understand is for medical expenses, your first line of defense really should be your hospital and surgery or the integrated shield plan. While the second line of defense could be an additional lump sum, all right, maybe through a critical illness or cancer plan to pay for the alternative medicine or cancers that are not on the cancer drug list, the drugs list. Okay. Now the next one, of course, is the loss of income. In the case of loss of income, you have severe stage. We recommend having at least 4 years of gross income replaced. And the next one is for early and intermediate, because it is detected at early stage, treatment is shorter, higher chance of recovery. Therefore, don't spend too much money to cover this. Okay, just 1 to 2 years of gross income will suffice. And by doing this and planning it this way, your cost of insurance will be a lot lower. The next one is an important question. Do kids need critical illness insurance? Now, we have parents who have bought whole life insurance for their kids. But let's understand this. What the primary purpose is really income replacement of the parent. Have the option to stop work, take care of the child who's going through difficult time with cancer or any of the critical illnesses. And then the secondary is to pay out for alternative care, give for a child. All right. And this is really not the top priority. The top priority should be parents. Do you have enough coverage for yourself, right, to take care of your family? Okay, so that's the most important thing first. All right, now I'm going to have a poll. All right, and this is where I would like everybody to just indicate for me the following question. All right, I'm going to launch it now. Let's give it some time. And once it comes up, yes, I would like to get your take. You might have heard this from your financial advisor, your insurance agent. Could you share a little bit of what they have told you or what you feel that perhaps should be the case in terms of the amount of cost? So for example, if you earn $50,000 a year, okay, then how much of premiums do you think is enough for you to fully cover yourself? All right. And of course, when you talk to agents, they will first tell you a benchmark. They'll give you a guide. They'll tell you, oh, you should be setting aside how much of your income. They set your mind ready for this so that you're ready to spend that money. What would that be? Yes. So I hope everybody can give their take on this amount. Yeah. It'll be good. I get more. I want to hit at least 60%. We're at 40, 50. Yes, that's good. Yeah, keep going. Yeah, everyone take part on it. Yeah, it'd be good to really get a sensing of how and what people have been hearing outside on the market. Okay, yeah. I just need about 8% more. Let's wait a little bit more as people click through this. Yeah. Okay. All right. Yes, it's reaching already. Yeah, very good, very good. I'm getting more responses. Very good. How much do you really need to fully cover yourself? How much of your annual income will it take to fully cover yourself, your loved ones, or your family? How much would it be? All right. Okay, good. All right. So I think I'll end the poll now and let's see the results. Okay, it's coming up soon. Is it up?
Sure.
Oh, share results. Oh, so sorry. Share results. Yes, is it up? All right. So everybody, you can see here, 20%, 20% of income for insurance premiums. Okay. And then, I see there's someone putting 25, two of us, 3% believe 25% of income should spend on insurance premiums. Okay. I'm happy to see that, 10%. All right. There. All right. So, and MoneyOwl, let me give you a guide. Okay. We believe that with a good insurance planning, you only need to spend between 5 to 7%. And this is based on our data with all our clients. Okay, so this is something I want you to keep in mind, not just for yourself, but also for your loved ones. Perhaps you have children who are going to start working. You want them to be getting the right advice, because if you spend less on insurance, okay, and you can set aside more for your life, you can also set more for your retirement in the future. All right, so these are very important things. So the guidelines between 5 to 7%. All right, so with this, I will stop share and I will move on to the next part. Okay, so the question is, can you get the cover you need at the lowest cost, and is it possible? So the answer is yes. I'm going to share with you certain types of critical cancer related plans, right? So you have late critical illness, early critical illness, and what is commonly known as multi-claim critical illness. This type of insurance, okay, is it allows you to get a claim. Now, the late critical illness one is the traditional one. Everyone is familiar with it. In the event of a serious late stage, $100,000, okay, will cost about 326 for a 30-year-old male and 345, okay, for a 30-year-old female. Now, this, because late stage critical illness is affordable, you can see it's pretty good. Now, in the event you need some early critical illness, then you have another insurance that I generated. You can see the cost significantly increases. Okay, and the last stage one is very interesting. It's called multi-claim CI. So it starts with clients who have a client in mind I had was someone who had stage 1 breast cancer. She recovered and she did okay. And what happened was 3 years later, she tried to apply for a critical illness and was rejected by the insurer. So multi-claim allows, after a 2-year waiting period, to claim a second and even a third time. Okay, so this is quite popular today. Interestingly, you can see here, the premiums are quite affordable compared to the early CI one that you see here. Okay, yeah, so these things are. Then the last one I will talk about is really the cancer only plans. All right, now, the reason why the coverage numbers are all different because they're all designed differently. Okay, so it's very hard for me to generate one that is the same number for all across the plans, but it gives you an indication. All right, for a cancer only plan, only for cancer, all right, getting 75K for early CI or late CI 75K, it costs 234 for male and 387 for female. Okay, now for this particular cancer only plan, if you get a late stage cancer, you get a total of 150,000. Okay, so this is something to take note of. All right, so it's pretty cost efficient, and you can do that. And I have another table to explain actually the products that MoneyOwl carries. We have 7 insurers, we have 8 insurers, sorry, and we find the best plans for you and all that to make sure it meets your need at the lowest cost possible. All right, so you can see over here with the coverage and the premium. It's a lot of numbers, but I just want to explain to everybody here. It is pretty affordable. These are, by the way, are annual premiums. Okay, these premiums are 156 for the TM Protect Cancers annual. Okay, it's an annual premium. It is not monthly premium. Okay, annual premium. So it's pretty affordable. Okay, these rates. And I want everyone to just think about it. If you have a critical illness gap, there are 2 options. You can get a critical illness cover for all 37 critical illness, or you might want to consider just getting a cancer one, okay, to beef up, and it might actually be more affordable for you. All right, so on this note, just some stats that I just pulled it out 2 days ago. Okay, this is on Ministry of Health, and you can see actually cancer is the #1 cause of death, right, in Singapore. All right, and you can see over here it's about 28%, while the other ones like heart attack, it's on a lower number, and it's been quite consistent over time. All right, for cancer. So I hope with this, I want to quickly share that because insurance, when you buy insurance, the insurer will give a commission to the company, right? So MoneyOwl is a distributor's financial advisory, so we do get commissions. But what we do is that for premiums that are very, very affordable, okay, very low, the commissions are very small. But for today, what we want to do is we want to give you back more than what the commissions can give. So for certain low cost premiums, okay, if you buy one that is low cost, affordable, just now you saw the numbers about 156, something like that, we will give you $50 cash back. All right. There are there are some terms and conditions, but I just want to share with you, it's better to get the coverage you need at an affordable rate. Okay, so I just want to encourage you with this promotion. Okay, now, buying insurance should always be fit for purpose. And I hope this picture doesn't put you off. At the end of the day, make sure that your insurance plan fits your financial plan. All right, and this is where the value of MoneyOwl stands out. Okay, we want to enable the people to make wise financial decisions to live their best possible life. And so it's about life. All right, it's about life, and it's not about buying products. Okay, it's about getting your financial plan in order. All right, so with this, I will end my talk and thank everybody for listening.
Thank you, Colin and Snehal, for your sharing. Especially Snehal, so brave of you and so inspirational to hear your story. Yeah, really glad that you came and shared with us. So now it's time for Q&A. I realized that we're actually over time, running late, but we will still try to answer a few questions. Some questions that came in, actually Colin already answered in his question, so we'll try to cover those that I didn't quite touch on. So one attendee actually asked, right, whether they should get critical illness or hospitalization plans for their elderly parents. So in an example, the parents are already over 65 and they didn't buy it when they're younger. Should they still consider buying critical illness for them? Is it worth paying the higher premiums?
It's not an easy question to answer, but the guideline is always to have your integrated shield plan for the parents. Yeah, body breaks down, they go to the hospital, and so you want to just make sure the cost of medical is covered. Okay, so that's the first foundation. That one, we feel is a must-have. It's a must-have. Having critical illness is good to have. I will share this a personal story here, very quick one. I know of a lady, and she actually had cancer, and it actually relapsed, and she was living a life, and she had children and all that. At the age of 65, she was informed by the doctor the cancer had returned, and this lady, she decided not to continue taking treatments. Okay, I just want to share this because everyone was shocked, all right, by her announcement, but she's a very firm lady, and she's not depressed. No, she's actually glowing with life, and she shared the reason is because she has gone through one time and she's experienced it, and she feels that she's done everything she can. She's so happy to see her children grow up and all these things, right? So she decided to stop, and exactly a year later, she passed on, in her own way, and all that. So I think this question for critical illness for the elderly should only be answered when we can ask ourselves, to what extent do we want to extend life, right? Yeah, I mean, yeah, and also if you do buy insurance, it's not going to be cheap. It's not going to be cheap, right? So let's take a look at the finances first, okay, to understand the cost. Yeah, because we have clients whose parents, whose dad, for example, are on what you call it, experimental drugs, costing about $5,000 per week. Okay, and what happened was, it's very difficult. This uncle, I remember, he actually went through the treatment and was so depressed that he warded himself in INH, Institute of Mental Health, because he felt really stressed out by the medication. There are some side effects. Yeah, so they extended his life. It was only supposed to be for 4 months. They managed to extend his life for 3 years. Okay, but the quality of life was not easy. That's why, yeah. So these are the things that we need to think about. Yeah, it's about life. It's not about, the money. It's about the life. But when we do planning and help clients decide on this, we need to talk to them, understand the money. We need to understand the money and understand the life. Yeah, so it's not so easy to answer this. Yes.
So now we know why he won first place at the financial planning awards.
No, they didn't ask about this.
Okay, and another question, I think it's also related to money and mindset. So, and also maybe to someone who's a bit older. So if a person's passive income exceeds what one actually needs for day to day, does it mean that there's no need for critical illness coverage?
Yeah, this is a good question. Generally speaking, to what extent is this exceeding, right? If it exceeds a lot and all that, and you feel it's okay, yeah, actually you might be self-insurable. You insure yourself. All right, so let's give it a very simple one. If you have 20 properties and each of them give you $5,000 rental income, all right, then you can calculate the amount of rental income. Some people try to spend, they cannot spend, all right, and yeah. So I think in this context, it's quite clear. The answer answers itself, right? Question. So I think it's clear. Yeah, it's okay. You may not need certain insurance, correct? Yes, yes.
Okay, I think we leave the last question of the night for Snehal. Snehal, are you
Yes.
still there? Hi. So
Hi,
it's one
Daphne.
question from the audience for you. So they wanted to know, how do you find hope in the midst of your cancer diagnosis and situation? What drives you and keeps you going?
So I think my first thing was my baby. I think you become like a tiger mom. You want to do everything. And he was my first kid, right? And I had him when I was 37. And I want to be there for everything. And I'm going to fight everything to just be there. So I think that's my first, I feel. And I feel second, I think I'm too young. I don't want to go. I have too much to give. I have too much to do. And I feel I have the right people around me to make it happen. So I honestly feel that there is, sometimes you have to trust your journey. You have to believe that, you don't know the outcome, but you have to do everything towards it. And then you just leave it at that and whatever happens. So I think these are some of my driving forces, certain beliefs that I have in my son.
Thank you so much. Thanks, Snehal, for sharing your story with us this evening.
Yeah, most welcome.
Okay. Thanks everyone for still staying with us. So before we go, we just wanted to share some promotions with you. We hope you found the session useful. And in leaving, we also want to leave some useful things for you to take advantage of. So I'll go through each of the promotions, but don't worry about the details. We'll email them to you after this event. So the first is the cancer insurance plan that Colin mentioned. So currently we have a limited time promo. When you purchase qualifying cancer insurance plans with us, you'll get a $50 cashback. And also we have, yes.
Definitely. Yeah, I just wanted to share with everybody that at MoneyOwl, we automatically rebate 50% of the commissions, right? We rebate first year commissions 50%. The reason why we're giving $50 is because some of the low cost, small premiums, okay, the commission is much less than $50. Yeah. So for today, to top up, and if anyone needs it, we will give $50 or 50% off first year commission rebate, whichever is higher. Okay, so I just wanted everybody to know that. All right, thank you.
Thanks, Colin, for the clarification. And we're also having a free Apple iPod and 50% first year commission rebate for certain insurance plan that you buy with us. So this generally is for plans with higher annual premiums. So more details and terms and conditions can all be found on our website.
Definitely this one, we have 300 only to give. Okay, and so far we have cleared 120. Okay, so we have still some left. Okay, so if you have friends, relative, or yourself, this is open to public. Yeah.
Yeah. Okay, and then in terms of investment, I think we have a new product, and it's a rather good product that we hope to share with you. So it's called Y Saver. It's our cash management product that offers 3 very good benefits. So firstly, it's the very high rates. So the current rate that we're giving is 2.75. It is a 5-day moving average and pegged to Singapore dollar deposits. So as your fixed D rates go up, this rate will also go up. So you get to enjoy it. And then the second benefit of this is that it's low to no risk because it's invested in Singapore dollar deposits. And the third benefit is that it's very high liquidity. You can withdraw anytime. There's no lock-in, and then you can get it within 2 business days. And now we're having a special promotion. For each one of you who open a Y Saver account, you'll actually deposit $20 worth of Y Saver credits for you into your account. So it's a very good promo. I think it's for limited time only also. So do check it out if you want to know more about Y Saver.
Yes, so definitely for this one, if anybody has friends, relatives, especially my mom age, 70 and above, they are always looking for the safest,
Highest
of the
fixed
highest, yes. So my mom bought something from another insurer, okay, and it was locked in at 2.3%, and she had to keep it for 1 year. All right. And so when MySaver went up to 2.75, then oh no. So instead of chasing things and locking things yourself, actually MySaver will follow and increase as the market goes up, especially when the Fed interest rate goes up, then it affects everyone. And then that's why the rates are so good today. So this is something very liquid, no lock-in. Yeah.
And also, as a financial advisory company, we offer a comprehensive financial planning service. So this service is basically like an online questionnaire where you share with us your financial details, and we'll give you a personalized report that will tell you the state of your financial health, and then maybe let you know how far you are towards your goals. So usually this report costs $99, but just for you guys, we're giving it to you free if you use this promo code. So it's a really useful plan. I did it myself a couple of weeks ago, and I found the information very useful and personalized for me. And the good thing about this plan is that once you enter your details, generate the report, actually you can go in anytime to update, like you have new kids, you increase your income and all that, and then we will automatically generate a new report for you. So this is something really useful, and I think if you have not tried it, I think it's a good time to try this out.
Yes, definitely. So I just want to say the story of the horse before the cart. This is why you should put the horse in front of the cart, and so plan first your financial life, and then talk about the insurance, talk about the investment, talk about the retirement. You need to start with that financial plan. So this has been through the data we've collected from over 5,000 different clients, and we have put it into a very simple to use. And so this one is free. With this promo code, it's free, and you can also extend it to your children, your loved ones. I believe above 18 years old, above 18, okay,
18 to 65.
65, yeah. So this is very good. Now, some people have asked, will I know my CPF payout, CPF life payout, right? So yes, 35-year-old, 50-year-old, you want to work out and find out if I continue working to age certain amount, what is my retirement income? All right. So whatever graph I showed everybody, okay, this is where you can see everything I've said. All right. And the Singapore Labour Foundation has put aside, I can't recall the amount of million, for all the union members to actually have the chance to go through this financial planning journey. So this is serious, and I hope everybody take the chance now. You don't have to pay a cent. It is editable and able to be done on your phone, on the go. All right. So make full use of it before it runs out.
And finally, we have a free health screening for our attendees today. So you get a free, I think it's a basic health screening at iWellness. And if you decide to upgrade and opt for more comprehensive packages, you also get another $5 off. So with that, we've come to the end of this evening. But before you go, do let us know what you think. Let us know your feedback, how we can improve, so we can improve our content and make it better and more relevant and more interesting for you. So thank you so much. Hope to see you at the next webinar, and very good night to everybody.
Good night, everyone. Sleep tight. Sleep early.